the recovery is actually much easier than the original TPLO surgery. What happens is when there's enough normal healing and an infection that hasn't prohibited healing, the bone cut has now filled in with new bone growth. It's strong again. So that means the implant can be removed, the plate and the screws, and the dog's leg will still stay together. Here's something that most pet parents get wrong. They think the TPLO plate has to be removed because the dog's body is rejecting it. Really what's happening? The dog has an infection, and that infection is so far in that it's affecting the plate. We can see if an incision looks infected. We see pus, drainage, red pustules, things like that. Well, this is so deep inside you can't see it. Maybe your dog is limping. Maybe they're wanting to lick their knee and surgery was months and months back. Or it could even be a year back and the dog is now limping and favoring that leg. But when the infection is deeper and it's now affecting the plate, this is where it gets screwy. A thing called a biofilm can form, and it happens way, way deep at the level of the implant. It actually coats the implant, this biofilm, and it protects the bacteria from the antibiotic being able to kill it off. So once a biofilm has formed, that implant usually has to get taken out. That's why the dog might keep getting antibiotics and it's not clearing up. They're still limping. They're wanting to lick their leg. The leg looks swollen. It's just not right. And that's when the vet says, we might want to take the implant out. Listen, your vet's not going to take out a TPLO implant if the dog's bone cut has not fused. Sometimes you have to wait a little while before the explant surgery can happen. So if your dog's TPLO plate and screws need to come out, don't worry. It'll be an easier recovery. Their infection should go away. Oh, and one more thing, bonus tip, ask your vet if they plan to culture the wound or culture the plate once they're in there. And that's where they actually take a swab and then they try and grow the bacteria on a plate and see what kind of bacteria grows. They'll do an anaerobic and an aerobic culture. Let's just say bacteria grow. They'll identify those bacteria and then decide, is the antibiotic the dog is currently on sufficient? Is it the right one? Or do we need to prescribe a better antibiotic that is proven to be able to kill off those bacteria? You should notice quite a bit of improvement after the implants are out, the infection heals up, and your dog is feeling better. Before you go, like, comment, subscribe. That tells YouTube, I think this video content's worth showing to other pet parents who are searching for this topic. Thanks so much, and I'll see you in the next video.